Imagine you're having a fever. You feel tired, your body temperature increases. So what will be your first drug of choice that pop up in your mind? Paracetamol, isn't it? So after having a paracetamol, after a few hours, you feel good, your body temperature also decreases. Does paracetamol actually cure your disease? What if I say no? So paracetamol actually doesn't cure your disease. It actually does a symptomatic relief. Interesting. So first of all, we need to know about fever. Fever is actually a rise in body temperature. But the most important thing you have to keep in mind, the fever is actually not a disease. It's just an expression of a particular disease or a particular infection, like bacterial infection, viral infection, etc. So what is the purpose of fever? It's actually rising of your body temperature, isn't it? So you must have seen your mom boiling milk or water to make it tea. So why does she do that? As per Louis Pasteur's pasteurization theory, he have taken a spoiled milk and analyzed in a microscope. He have seen a bunch of microorganisms in it. After that, he decided to boil it, and then he analyzed in a microscope. He have noticed there are absence of microorganisms in it, except a lactobacillus, which is not that harmful for our body. So he have concluded the theory that after boiling, after heating it up, the microorganisms actually dies. So coming back to the concept of fever, our body temperature is actually increasing to kill these bacteria or viral infections. So what is the mechanism of fever? Any kind of microorganisms that enters in our body through inhalation or any other route, it actually causes infection, isn't it? So our body will secrete some inflammatory mediators like biogens or interleukin 2, and it also secretes prostaglandins. So what is prostaglandins? Prostaglandins is actually a local hormone that stimulates the hypothalamus to increase the temperature. So first we need to know how prostaglandins is synthesized, or what's the cause of this synthesis. So if any kind of inflammation cause, like bacterial infection or any other kind, there will be a secretion of an enzyme called phospholipase A2. This phospholipase A2 will convert into arachidonic acid. So arachidonic acid is a substrate of two major enzymes, which is cyclooxygenase and lipoxygenase. So let's focus on cyclooxygenase. Through that path, the activation of fever is causing. The COX enzymes exist in different forms, which is COX-1 and COX-2. COX-1 stimulate normal body functions like production of gastric mucosa, promotion of platelet aggregation, but in COX-2 they mainly focus on increasing the pain or increasing the temperature. So increase in the temperature, that's where the activation of fever occurs. So there are different forms of prostaglandins like PGG2, PGH2, PGI2, PGE2 and TXA1. So PGE2 is responsible for increase in temperature or increase in pain or decrease in uterine tone. So what is the role of paracetamol? What happens when we have paracetamol? Paracetamol is actually an NSAID drug, non-steroid anti-inflammatory drug. It actually inhibits the production of cyclooxygenase enzyme. So what happens when we inhibit cyclooxygenase? The other productions of prostaglandins will not occur. So the production of prostaglandins are inhibited. So we will get PGE2, which is responsible for the rise of temperature. So there won't be any productions of prostaglandins. So hypothalamus won't get any signal or any stimulation. So what happens? So what happens here? After taking paracetamol, our body temperature decreases. So we think that after having paracetamol, we are actually curing our disease, but the reality is we are promoting it because we inhibit prostaglandins that decreases our body temperature, but the microorganisms that is infecting our body, it's actually growing, actually replicating. Bacteria will secrete some kind of toxins that actually turns out to be another diseases, which is huge and catastrophic. So you might be thinking that having paracetamol is an utter bullshit. No, it definitely not. We can have paracetamol with a combination of an antibiotic, which could be amoxicillin or azithromycin, etc. So by having this antibiotic, This antibiotic drug will actually kill this microorganism or kill this bacteria. Along with that, this paracetamol which help you to regulate your body temperature along with killing the microorganisms by the antibiotic. The COVID crisis is increasing day by day, and we can see in WhatsApp status or Instagram stories that we have to buy more paracetamol and have them. But by having paracetamol alone, it's not actually curing you. So you have to consult a doctor when you feel fever or something. The doctor can analyze by your symptom whether it is a bacterial infection or a viral infection or any kind of infection. So they can prescribe an antiviral drug or antibacterial drug or antifungal drug along with paracetamol, so that it can cure you, also it can regulate your body temperature. I hope you have gained a lot of information from this video. If you like this video, please like, share and subscribe. And we are about to launch an online tutorial website for MBBS students, www.nichemedics.com. In this, the classes are conducted by our professors and with a lot of animation stuffs, so that you guys will gain a visual treat and enjoy every topics of MBBS. Niche Medics, a tool to medicine.